Hi, I'm Dr. Alexandra Filingeri, registered dietitian, doctor of clinical nutrition, and I'm sitting here with world-renowned plastic surgeon,
Dr. Thomas Romo, a plastic surgeon in New York City. I'm here to introduce you to our new podcast, We Got Your Number.
We are here to break down evidence-based information and real-world experience, and we're going to bring in some of the top experts in the world because
we got your number. How can we improve diabetes treatment in this country?
Let's bring in experts and really talk about what supplements actually help.
Can we improve our sleep health by using these medications?
How much protein do people really need to eat?
Can nutrition solve all of our problems?
What happens if someone comes off their weight loss medications? Welcome back to the We Got Your Number podcast. I am so excited to be here today with Dr. Zinaria Williams. Dr. Zinaria Williams is a board-certified and fellowship-trained hair restoration surgeon, oculofacial plastic surgeon, and reconstructive surgeon, clinically trained herbalist, and author. So we have a very qualified guest. Hi, Dr. Williams.
Hi.
Welcome to the podcast.
Thank you, Dr. Ali. Pleasure to be here.
So I want you to explain to our audience how you got into your line of medicine and what is it like being both a hair restoration surgeon, an ocular plastic surgeon, and an herbalist.
Yes, I started out in oculoplastics, and while I was practicing and raising my children at the same time, I decided to do more training in herbal medicine. And going through herbal medicine, I learned how to see the body in a holistic way and decided to shift into a medical field where I could use that and see the whole body. And hair is one way of doing that, because hair is an expression of what's happening within us, within our body, and it touches on so many things. And I could incorporate my herbal medicine side, a holistic approach side with hair. And that's kind of how it branched together.
And that's a really interesting cross-section between the two. Can you talk to me about the types of patients that typically come into your practice?
Yes. Half of our patients are women, which I love. And I think it's great that women will take the time to do something for themselves, because oftentimes they don't.
Yeah.
And we'll see people from different ranges, those who have early hair loss to more extensive hair loss. And I always tell people, even if you start noticing thinning, it's better to come in and get checked out, because there are different types of hair loss and hair thinning. Some of them need specific treatment, such as anti-inflammatories or other sort of more medical treatment. And if you're not addressing that, then everything else you do is not going to help.
Right. So it really makes sense, the expression from the inside out. And you said you do a lot with women, or you see a lot of women coming to you.
Yeah.
What is that woman like when she first comes to you and she's noticing that she's seeing changes with her hair?
I keep a box of tissues on my desk. It's very emotional.
Yeah.
And I acknowledge that.
Right.
A lot of women come to us having seen other people and not having been taken seriously, because it looks like they have a full head of hair.
Right.
But they know they've lost 50% of their hair.
Right.
So I get it. I understand. I believe you. And what can we do to get things back on track, or to figure out what is actually going on?
Yeah. So sometimes being a woman, right, and going to a doctor and not being taken seriously, it scares them away, where they don't necessarily want to come back, but it sounds like they're in really trusting hands when they do come and see you.
Well, I think it feeds a negative narrative that this is frivolous, I shouldn't be worried about this, this is so vain. But, it's not.
Right.
And I think when women are turned away, even from hair transplantation, there are some surgeons who don't operate on women. And I feel like you give a woman something to work with, then she can have a really great quality of life. It doesn't have to be exactly equivalent to what men's needs are.
So when we look at it from the holistic lens, let's start with nutrition, which is an area that I am quite interested in myself. What are common nutritional concerns that you see in women dealing with hair loss?
Yes. We see unfortunately, a lot of young women coming in with very extensive hair loss, early 20s. And a lot of times we can narrow that down to nutrition, meaning disordered eating, or hormonal, like PCOS or PCOS-like picture. And so having that conversation, again, having that holistic conversation, which I cannot always do in my other field of medicine. But here, that's an essential part of the process of growing hair. You need the building blocks to grow hair. So I always ask about someone's diet. What are you eating? Are you eating vegetables? A vegetarian, are you eating vegetables every day? There are some vegetarians that don't eat vegetables.
Right. Yeah.
So are you eating healthy fats? So I do go through a list of things that I know are good building blocks for hair, because you can't supplement yourself out of a good diet. You can take the supplements, but a
Correct.
diet is really the core. And if you can get that in your diet. So I do have that conversation with patients often.
Two questions. And the first is, you talked a little bit about the building blocks for hair.
Yes.
Can you talk a little bit more in detail about that?
Yes, protein is very important. I have many patients who are vegan, and there are plenty of protein sources that don't have to be animal based, but
Right.
I make them tell me what those are.
Right.
There are zinc, vitamins such as vitamin and minerals such as zinc.
So
Sorry, it's
what
like
I'm
a
hearing is
brain
the building
fog.
blocks: protein, fats, and energy, but secondarily micronutrients. So talk a little bit about, I guess, the correlation between vitamin deficiency. What are the ones that you tend to see most in practice?
Well, the patients who have disordered eating and have multiple nutritional deficiencies, those are the ones that we see with hair loss. I have a patient who is in her 70s and was very much identified with her disordered eating. She has, she's been struggling with it for years, decades, and even partnering her with a dietitian, it was clear that she wasn't willing to change. And so there's only so much we can do to help your hair if you are not able or willing to do that basic part. Because we can give you medications, we can do a hair transplant, we can do platelet-rich plasma, but if you don't have the building blocks there, then it's a waste of time.
And I think that's an extremely important message, because oftentimes what I see in my own patients struggling with eating disorders is that it's not always the eating disorder that brings them into a primary care or even a specialist office. It's, my gastrointestinal tract isn't working the way it should, or it's, I have fatigue, or, in severe cases, it's where they're, volume depleted, or their heart rate is low. But sometimes it's not the disordered eating, but it's, why is my hair falling out?
Yeah.
And I find that once you dig deeper, and it sounds like as somebody that digs deeper, then you can get down to those root problems. And if it is disordered eating, I really appreciate the concept of, we can treat the hair, but part of treating the hair is treating the body
Yeah.
in a, comprehensive way.
Exactly. She didn't come in saying, I have anorexia and my hair is falling out.
Right.
It was that her hair is shedding everywhere. Digging a little bit deeper, instead of just giving her a prescription for minoxidil or what have you, finds the root cause. And we have to deal with that root cause, and it's up to her to decide if she wants to tackle that or not.
Yeah.
Yeah.
And it takes the motivation and the readiness to be in that place. Now, how do you incorporate the herbal medicine with the traditional medicine for hair? Because that is the most fascinating thing to me, and it's something that I think makes you so unique in your field, because I don't think I know any, to my knowledge, physicians that are working in hair transplant, that are working in ocular plastic surgery, that also look at herbal medicine. So pretend I know nothing about it, which
Yeah.
I really don't, and tell me more.
Yes. So when I started my herbal medicine training, I did a 3-year program at a school called Arbor Vitae, School of Traditional Herbalism. I honestly wasn't sure in that first year where I was going with this. I just was following an interest. And I realized that I don't have to choose. I don't have to be just surgeon or just herbalist. I can actually merge my worlds and bring them together. And I found that bringing them together, they both have excellent qualities, but when they're brought into the same space, it even magnifies the outcomes for patients. So right now, there are a lot of supplements and herbs for hair growth, and I've decided not to go into hair growth per se for the herbs because there's a lot out there. But what I want to do is help my patients heal during the surgical process. And so that's how I'm merging herbs with surgery. So, for example, there is a cream that we use for patients when we do a certain type of procedure. We put it on their scar to help reduce inflammation. What I did was I did research on wound healing, found a few different herbs that are clinically proven to help different aspects of the scar maturation process. And I added those herbal extracts into the existing cream that we have. And I did a half head study, and it was remarkable how much better the herbal extract plus standard of care did compared to just standard of care.
That's totally fascinating.
So now we're just using that herbal extract with the base.
Right.
So not taking things away necessarily, but combining them together.
Yeah.
And we found that worked, and looking for more ways to incorporate herbs into the recovery process of patients and preparing them before surgery, because healing happens before the scalpel.
Right.
So if we can get patients' immunity up, help their stress response, several different things to help even for wound healing before the surgery, it puts them in an even better state after the surgery for healing and
Right.
coming back into balance.
So getting really strong post-operative goals is starting way before
Yes.
the surgery process, way
Yes.
before they even walk through the door and book the surgery, but really having that strong foundation of health.
Yes, it is. And if they don't, if they come in already depleted, somebody who gets
Right.
sick all the time, they could be on a protocol that's a couple weeks before the surgery, because the surgery already puts you in a depleted state. You're losing blood. You're having a lot of tissues cut. Your body has to go through a process to repair. So the body needs more to recover itself, to heal itself. So if we can set the body up in a position where it's already primed and more restored, then the outcome of even the surgery, but also just the recovery process would be even better.
And if you had to share what for you feels like the core principles of herbal medicine, what would they be? Or what would they be for you?
Looking at the whole body. And in allopathic medicine, we were taught to look at certain sections of the body. I mean, we're separated so much in our subspecialties. Even in ophthalmology, you've got the back of the eye versus the eyelids,
Right.
but those 3 years taught me that it's all connected. So, and this is something you know very well. I mean, the gut is connected to so many things in our
Yeah.
body, right?
Yeah.
Including hair.
Yeah.
So why aren't we addressing gut issues when we're talking about other, parts of the body, other conditions, for example? So, yeah.
I was at a obesity conference in Spain probably 5 months back, and there was emerging research looking at the gut. And I'm like, why are we just starting to look at this now? Right? Understanding that the foods that integrate into our body influence the microbes that live in our gut, and those microbes produce molecules that are bioactive, and they influence how our body, responds to food, how our body responds to emotions, and so on. And I really appreciate that approach that
One
you
of my
take.
one of
Yeah.
my teachers says, you aren't what you eat, you are what you absorb.
Yeah.
So the integrity of the gut is very important, because people are taking all these supplements, are you even absorbing them?
Yeah.
Are they just, going down the drain?
And I think and I'm interested to hear how you went about this in creating your supplements. I always think that people find that the highest dose is the best dose. And oftentimes I find that one, just at the level of, the intestinal cell, we can saturate those receptors. I mean, we don't absorb super high doses of supplements, but how do you, I guess the dose is the poison or the therapeutic dose. How did you decide what to put into your supplements?
Even again for the tincture that I brought today called Chill TFO. It's one of my best sellers because people have a lot of stress these days. There's a lot that we're putting on our plates. This is the first week of school. Every parent is stressed, I can tell you that.
Yeah.
But I love these ingredients, but you're right, more is not always better. One of my favorite herbs is Schizandra. It's a great adaptogen. So it's good for modulating the HPA axis. It's based in traditional Chinese medicine. It's a 5-flavor herb. It's sour to me, but some people taste sweet. Some people taste other things. But what I love about it is in addition to being a great adaptogen, it also helps you focus. It just kind of puts blinders on you and you can focus on things that you need to pay attention to crystallize more. That's my experience with it. So I wanted to put it in this formula, which is about calming down in the setting of high anxiety or being around something that's triggering you, because I want someone to have the adaptogen to just kind of relax their stress response, but also be able to focus on what's important.
Right.
So that is why Schizandra is in there.
Yeah.
But I didn't load it with Schizandra. You don't need that much.
Yeah.
You need just enough. And so there is a balance in when you're creating a formula. You pick out the herbs that you want, and there is the star player, like the chief, and then you have the accompanying herbs that help support that one. So Schizandra, even though I really love it, it's a supporting herb to the other ones that are there.
That's interesting. Do you base it off of as well, I guess, the information or like the literature around how herbs interact in the body?
People have been using herbs for millennia.
Yeah. Very interesting.
Thousands of years
Yeah.
of tradition, and including traditional Chinese medicine, Ayurvedic medicine. Like these practices have been around for a very long time. So not every herb has a clinical trial. And some are evaluated looking at certain things, but they're not all evaluated. But we lean a lot on tradition. And it's so interesting that the same herb is used for the same thing, or as a remedy for the same condition in many different cultures that had no connection with one another. And so tradition does fuel a lot of this, especially using a lot of the traditional Chinese medicine herbs, which I do use a fair amount.
That makes sense. And I think that my final question for you is, if somebody is thinking about coming to see you because they are struggling with hair loss, or they're interested in herbal medicine and how that can support them along their journey, what would be an encouraging message for someone that feels, let's say, nervous or isn't ready to take that next step just yet?
So there's a range, and this is what I tell patients, there's a range of things you can do. Not everybody wants to take a pharmaceutical medication. Not everybody wants surgery. Some people would like to start more on the herbal side of things, supplements, and things they can do at home. And so there's so much online. Our phones are listening to us, and so many things will pop up, and you don't even know if it's real or not. And that's a common question: is this real?
Right.
So I think it's good just to find out what are the options, like what are the things that have been proven with clinical studies, what things are right for you, because not everything is right for every single person,
Right.
depending on the type of hair loss you have. So I always tell people to just get evaluated. Just have your scalp looked at, get evaluated, get a diagnosis. What is the cause and the source? Is it stress? Is it something we need to address and work on your stress level over a long period of time? Stress hair loss Is it hormone? Is it genetic? Is it something more serious in terms of an inflammatory or scarring alopecia? So getting an evaluation is the most important.
Yeah, so not really jumping to anything, but really going to see a person that's well versed in giving you the right information.
Yes, and that's open to having the conversation if you don't want to do the mainstream approach.
Yeah.
And I think that's what I offer. If I have patients come in all the time who don't want to take pharmaceutical medications, and I say, okay, so this is where we are, this is what we can do, and I'm open and happy to have that journey with them and see, how well we can do respecting their wishes and what they want to do for their body.
Amazing.